So yes, so if you're just logging in, you got here just the perfect time because in 3 minutes, just 3 minutes, I'm going to share with you the knowledge that took me well over a decade to acquire through a lot of patient experience, seeing thousands of patients, traveling all over the country, interviewing other psychiatrists, seeing patients experience just transformation after transformation, bringing that to my own practice, sharing that with the people in the community of Columbia, and watching people go from death to life, watching them go from just severe sadness to joy, to lessen suffering, to watch people who were so anxious they couldn't even come outside get re-engaged with the community. Just watching people who struggle with their mental health finally find relief because of the work that me and my team have put in to uncover these secret pearls that I'm going to share with you. In fact, your doctor may not even know about what I'm going to teach you today. And in just 2 minutes before we get started. So it's really important. I want you, if you're listening and you have depression, and you're listening, you have anxiety, you have PTSD, it's now the time to lock in. Get something to write with so you can take notes. Make sure the kids are out of the room so that you can focus. Make sure your dogs and your cats and your birds and fish are taken well care of so they don't distract you from the information that could change your life. Now, in just 90 seconds, we're going to launch and we're going to lift off. We're going to learn something that you just didn't know that's going to change your life. So please keep in mind, since we're talking about uh, something that is, I guess, a medical thing, and there may be patients online watching here, I want to protect all of your identities. I want you to feel safe to ask questions and type in the chat. In fact, the more you type in the chat, the more energy I get from to give you the presentation and to share this information with you. Because in 1 minute, just one more minute, I'm going to unlock the secret. I'm going to unlock the path that's going to lead you with the exact steps that you need to take to free yourself from depression, from anxiety, from just not sleeping at night, having nightmares every night, to not being present as a spouse, not being able to be the best version as a parent, not being as productive at work, not making the money you want to make. I want to share with you in just 30 seconds how you can break free from depression and its gang of friends, including anxiety, including PTSD, including, struggling with things that's happened in your past, grief. I want to give you some tools that's going to help you overcome these things without the disappointment of ineffective medications and the side effects they produce. So, without further ado, we're going to get started. Welcome. Just welcome. I want to respect your time. We started right on time for this webinar. I usually don't, I'm always late, but this time I started right on time because I respect your time and I want you to get the most. I'm going to pack in a lot of information. I want to leave you with some hope. I want you to be encouraged. I want you to know that other people have been successful with this strategy, with these exact secrets, these exact steps I'm going to share with you today have worked for lots and lots of people, and it's going to work for you. Just got to listen up, buckle in. So, today we're going to talk about the 3 hidden breakthroughs for depression relief your doctor never told you about. And I'm going to share with you what I've learned from over a decade of experience has led me to figure out these exact steps to take to finally fix your depression. But these lessons came at a high cost. Before we dive in, my name is Dr. Don Dubose. I'm an interventional psychiatrist here in Columbia, South Carolina. Thank you for being on this webinar. And we're not here by chance. You were led here for a reason. You clicked to join this webinar for a reason. That's because, like many of my patients, you're probably suffering. You're probably not your best self. You're probably just not living the life that you want to live. In fact, you're probably a lot like a patient I want to tell you about. I'm going to call him John. That's not his real name, but I started working with a gentleman named John before I started my practice, Future Psych Solutions. I was still in my training when I started this private practice, and he was one of my first private patients outside of training. And I worked with him through my training as he graduated college, got married, had his first baby, and we kind of grew up together. Me as a professional, him as a young man. And he was one of the patients I was seeing him for weekly therapy, so I got to see him very frequently and became very close with him and his family while I was trying to take care of him as he struggled through his depression. Now, John has struggled with depression since an early age, and he had tried medication after medication. And when we met, I did just enough to keep him alright. You know what I mean by that. You're feeling better, but you're not thriving. That's where John hung out. And he had gotten married, he'd had his first child, and unfortunately, his depression was keeping him from being the best husband and the best father. So his wife at one point was so fed up with his inability to be kind to her and to help out with the family that she asked for a separation. And unfortunately, that was a straw that was breaking his back. So his depression got worse and worse and worse. And I did everything I could to keep him out of the hospital. So I did what I was trained to do. I changed his medications. We tried a SSRI. We tried a SNRI. We added an augmentation strategy, added antipsychotics, gave him sleep medicines, told him how to exercise more, and just did everything I was trained to do and followed the algorithm that most doctors take when they're trying to treat depression and anxiety. And for whatever reason, we could not break free until one day I tried a new combination pill. It was a new medication at the time. It was called Symbiox. And I started him on that medication. He came back a couple weeks later and he said, Doc, I'm feeling so much better. Like I'm not where I could be, but I'm finally coming out of the pit. And I was excited for him. So I gave him a handshake, gave him a hug. He said, Doc, thank you so much for everything you've done. Thank you so much for working so hard to try to help me. I have to go out of town. I'd like to see you back in a few weeks. Is that cool? And I was like, of course, of course. I let him leave my office. I said a little prayer, thank you, and went about my day. But unfortunately, that was the last time I ever saw him. What I found out is he had left my office. He went to a church parking lot. He had a conversation with his wife, and unfortunately, the conversation didn't go the way he wanted. And in a moment, he made a decision to take his own life. And I found out the very next day, and I was devastated. Like, I couldn't believe it. I couldn't believe that he had lost his life. He just told me he was feeling better. I did what I was trained to do. I managed his meds. I gave him therapy. I encouraged him. I did everything I could think of to do for my training. And what made it more impactful that his wife came, showed me his text messages and his emails, and it dawned on me I was reading this person's last words, and it shook me to my core. I wanted to leave psychiatry, but fortunately, a good friend of mine encouraged me to go to his memorial service. I didn't want to go. When I got there, however, his mother saw me in the crowd, and once she saw me, she just beeline towards me, and I just knew that she was going to slap me in my face and serve me litigation papers. She was going to sue me. That's what I thought. My heart was beating out of my chest. But instead of slapping me, she grabbed both of my hands. She said, Dr. DeBose, don't worry. I know the things that you said to try to encourage my son, to inspire my son. But unfortunately, he lost his battle with depression. And she started crying, and I started crying. She said, we don't blame you, but I do have one request. She said, please do your best to make sure this doesn't happen to someone else's son, to someone else's father, to someone else's husband. And those words stuck with me. And I changed my whole career to solve one problem, to figure out how to finally fix depression. And on that journey, I was able to talk to other doctors and research and use all of my resources to look outside of the box, to look inside the box deeper, to look everywhere to find treatments and effective things that were safe, that they were evidence based and they worked, and that everyone else wasn't doing, so that I can finally find the exact steps and the exact hidden pearls that will finally help you fix your depression. And that's what we're going to talk about today. We're going to discover what's really going on in the brain and with the brain, and finally see the advanced treatments that are helping people just like you when medications have failed. Now, if you've failed a medication, in fact, if you failed more than two, please type in the chat. Say, that's me, that's me, that's me. Okay, I see. Yes, a lot of them coming in. Because unfortunately, that's a problem that many people have because it's based on probably one of the best marketing campaigns and the best tactics that a pharmaceutical company has ever put out. Is that depression comes from a chemical imbalance in the brain. So what if I told you that the real reason you're still depressed isn't just because of a chemical imbalance? See, it's actually never been shown in research that a deficiency of these neurochemicals is the reason that people get depressed. Now, there is a correlation, but it's not scientifically proven that not enough serotonin or dopamine or norepinephrine is the reason for depression. And there are other things out there that can help. Now, this isn't just a theory. These new treatments are things that we do at our clinic every day using this cutting edge neuroscience. And in the next 30 minutes, I'm going to show you what your doctor won't. And I'm going to share with you what actually works when medications have failed. I spent my whole career trying to solve this one problem, and we're going to figure out today how to fix your depression. We're going to do that with just three secrets. So, if you're here, it's clear that something isn't working. You tried the medications. You're not back to your best self. You tried therapy. And even though that can be helpful, it hasn't gotten you to the mountaintop. You're still stuck. Let's start fixing that today. So here's what we're gonna do. We're gonna uncover three secrets. Number one is why meds won't always work. And they definitely won't always work when you're just doing medicines by themselves. Number two is seeing is believing. We're going to take a look into the brain. In fact, you can actually look in the brain, see what's not quite working right, and explains your symptoms, and then do something about it. And then how new technology and techniques are really changing lives right now. Like, not in the future, not 10 years from now, not experimental things. These are things that are out there that your doctors have not told you about that's been holding you back from getting where you want to be. So let's start with one of the biggest myths in mental health, that antidepressants are the best and only way to treat depression and anxiety. Now, don't get me wrong, antidepressants have a role and they can help and work for a lot of people. But if you really think about it, if you're still hearing this webinar, you tried a few medicines. And some of you tried a lot of medicines. In fact, type in the chat how many different medications that you've tried to try to help yourself with depression and anxiety. Put it in the chat. Put it in the chat. I see two. I see one. Okay. I see four. 12. 12 medicines. That's a lot of medicines. And still not feeling better. So I just want to reassure you, if you've had that experience, you're not alone. There's other people that are struggling with depression and anxiety, and the medicines are just not cutting it. And in fact, you go see your psychiatrist, and he's writing the prescription before you even walk in the room because he's doing trial and error to figure out what's going on. In fact, you don't need a new prescription. What you need is a new approach. I want to tell you about Jesse. Now, Jesse had an experience that a lot of you have, and I saw that in the chat. A lot of you have this experience. But actually, Jessie was a daughter of one of my close friends, and I'd always known her to be this happy, upbeat kid and a happy teenager, but deep down she was really struggling with depression and anxiety. And when her parents asked me to see her, I was just surprised that she was that ill. In fact, she had been seeing a psychiatrist for a long time since she was probably about 12 years old, and she had run through several antidepressants to the point that the psychiatrist had run out of ideas for her. And her psychiatrist told her that she's going to have to learn how to live with depression for the rest of her life. And this woman was like 20 years old. And she came to me and she broke down in tears in my office and she said, "My doctor says I'm never going to get better. Is she right? What can you do for me?" She had already started to give up. So I told her, "Your doctor was right about one thing, but wrong about everything else." She was right that antidepressants were likely not going to work for her. But she was wrong that there weren't other options available for her. And fortunately for her, she was open minded to do some of these new options. And we found something that really worked for her. And I helped her get better. And I want to share those same ideas. So if you've tried everything and nothing works, you're in the right place. If you think that depression is just who you are wrong. Depression and you are two different things. So if you've had this experience, that depression is overtaking your life and you've tried a lot of meds and it's not working for you, please type yes in the chat. Type yes in the chat. Type yes in the chat. So let's let's move on to show you the data about antidepressants. Here's the truth, and this is the secret that your doctor's not sharing with you. See, the truth is a third, 33% of all patients with depression and anxiety and all these struggles just don't respond to antidepressants. So that means if 10 patients come into a doctor's office, three of them can expect that it just won't work at all. Another three can expect that, hey, it's kind of working, but it's not really helping enough. And then three and a half will get some results from the medications. See, if you have failed two or more antidepressants, the chance of the third antidepressant working for you is not very good. In fact, 86% of patients who fail two antidepressants won't respond to that third antidepressant. If you've failed four antidepressants, excuse me, if you failed three antidepressants, the chance of the fourth one working for you is less than 7%. It's like 6.9%. This is based on one of the largest studies done to assess how well medications work. And all psychiatrists across the country base their prescribing patterns off this study. This is called the STAR-D trial. And the algorithm, how we treat antidepressants, come from this study. Because we know that antidepressants, oh, of course I ran the slides forward too fast. See if I can get it to go back. I can't. See, technology beat me up. Well, at least you know this is live and this is real. Messing up. But here's what we do know, and this is the data that was on that last slide, is that even if you failed antidepressant in the past and you find one that works, the studies show that the chance of remission on that the chance of recurrence of your symptoms if you find an antidepressant that works is very high, and the time until you relapse on average is about 3.1 months. So if you fail two previous antidepressants, technically you're considered treatment resistant depression. And that is a title that a lot of doctors don't hand out, but it's true. And it's based on the data. And based on the data, if you find an antidepressant that works, your average time to relapse is 3.1 months. And the likelihood of you finding one that works for you, that gets you all the way to remission, is very low. So the old way of thinking was, well, my med's not working, let's try another one. The new way of thinking is that medications can help, but it's only part of the story. In fact, the brain needs some rewiring to happen. Something different has to happen. So that leads us to secret number two. Now, did you ever wonder why your doctor never bothered to look at your brain? Like, in all of medicine, if you go to a doctor, it's usually the same sequence. They ask you a bunch of questions, you tell them about their symptoms, They get an idea of what may be going on. They order tests, and if necessary, they get imaging. So they get an X-ray, they get a CT scan, and then with all that information, they make treatment decisions. Unfortunately, in psychiatry, it's not like that. We don't always do that. In fact, we prescribe powerful brain-altering medications that may have some pretty serious side effects, all without ever looking at the brain. And unfortunately, that's how I practice too. Until one of my colleagues in Colorado called me. So my friend calls me. He said, "Hey man, I just had a patient, and we did this new treatment, and they had the most severe depression I've ever seen, and 4 weeks later they're like a brand new person." I'm like, "Oh my gosh, what are you doing?" He calls me back another week later. "Oh my goodness, you won't believe it. I have a patient who had autism. She barely spoke, and now she's engaging." I thought it was snake oil. I had to search and find for myself what were they doing and how were they doing it. And that's when I discovered secret number two is that you can actually look at brain activity and do something about it. And I discovered something called personalized TMS or transcranial magnetic stimulation. How you can actually look at the activity of the brain and do something about it. And I couldn't believe it. Sometimes you can't fix something unless you can see it first. And that's what your other doctors do. In fact, that's what your mechanic does. He listens, he looks around, he sees what's wrong, and then he fixes the problem. And for the first time, I thought I had found the holy grail in psychiatry that I can actually look at someone's brain, see what's going wrong, and then create a personalized prescription for them. That was mind altering. So we decided to add this treatment to our office. And our very first patient that decided to do a brain scan, let's call her Jennifer. We looked at her brain, and I was so shocked that her brain told a story because I had never seen this patient. I didn't do her history. I didn't know anything about her mental health history. And I worked with a doctor. His name's Dr. Kevin Murphy. You can look him up. He's in San Diego. His website is Peak Logic. In fact, it's prtms.com. You can check him out. But Dr. Murphy came to my office from San Diego and he was teaching me how to read the brain scans. And he looked up at the board and he saw the brain scan and he had never met the young lady as well. And he looked at the brain and he said, did you get hit in the back of the head? And immediately Jennifer started crying. And I was like, what just happened? He's like, yes, I can see that you got hit in the back of the head. She was like, oh my God, how did you know? I got hit in the back of the head with a crowbar. He's like, yeah, I can tell. I can look at these concussion bands here on this scan. And you probably have poor night vision and you probably struggle with glare. Is that true? She was like, oh my gosh, yes. I started having to wear glasses after that head injury. I can't really see. And he looked at the scan again. He said, and it's clear that you struggle with depression and you have a lot of anxiety and you haven't been sleeping well. In fact, you're tired all the time. Is that right? She's like, oh my God, I can't believe it. And she just wept. And I asked her, like, why are you crying? She said that it just validates that it's just not just me, that I wasn't too weak to overcome this problem, that something's actually going wrong in my brain. And that was a big revelation for me. It was my aha moment that, hey, that people aren't just depressed because of a chemical imbalance in the brain. People are depressed because the brain is an organ too. And it creates brain waves, just like your heart has waves when you get an EKG. And if the brain is not doing what it's supposed to do, you're going to have symptoms. And now I have a tool that can help you see how the brain is operating. And Jennifer believed in the science. And she thought that was amazing. So even though she lived over 90 miles away, she would drive back and forth to my office to get this treatment until she got better. And thank the Lord that she had amazing results from the treatment. And she made me a true believer in this part of the strategy of secret number two is that to improve from depression and anxiety and these other problems, we need to look at the brain like an organ, not just a set of symptoms. And that is the newest thing in neuroscience that we are bringing to the community of Columbia. It's not just your emotions or your circumstances that cause your symptoms. It's actually your brain because it's an organ. So now we can see it and see what's happening and do something about it. I'm going to show you an example of what a brain scan may look like because your brain waves tell a story. So what we're looking at, I'm going to do this very, very briefly for interest of time. So what we're looking at is a young lady's very first brain scan, and this is her last one on her treatment. And this is called a spectral EEG that takes about 20 minutes to do. It doesn't require any gel, but what we're looking at is the activity of the brain. And let me quickly orient you. If we go look at the very top, and I'm going to pull out my highlighter. Bing. Can I pull out there's my laser pointer. So if you look at the top bars here, these letter number combinations are each different regions and areas in the brain. This is going from the front of the back, the front of the brain to the back of the brain. The last lead is the heart. On the bottom are numbers. These numbers correspond with how many firing per second. We call that hertz. That's basically like the speed of the brain. And then the thickness of how these bands play out represent how many cells are going at that speed. So the thicker the band will tell you that the majority of cells are going at the speed. So for her, in the middle of her brain likes to run at about 9, and we'll call it miles per hour, but it's actually measured in hertz. Her brain wants to go at about 9 miles per hour. Okay. However, she has lots of her cells, and see how thick these bands are here, that are going at slow miles per hour, 3 miles per hour, 4 miles per hour. So that's called slow wave activity. It's characteristic of depression. Ideally, the brain will have one little mountain peak in the middle, but she kind of has a mountain range. So what that tells me is that the brain is not efficient in the front part of the brain. Now, why is that important? Well, that's important because one, the front part of the brain is important for mood regulation and telling you to be happy. It's responsible for threat detection, so it tells you whether to be anxious or not. So if the brain's going too slow, you're more likely to be depressed. So on her, she has lots of slow activity. The little peak in the middle is called an alpha wave. So she doesn't have well-formed alpha waves. That's a sign of efficiency. So it's telling me her brain is not efficient at the job it's supposed to do. And then she also has thickness on the right side, so at the fast speeds. So parts of her brain, especially her mood regulation center and her threat detection center, is going too fast. So that's telling her to be anxious. So we did her treatment, and the purpose of the treatment is to speed these slow cells up and to slow these fast running cells down so the brain can create the right pattern and frequencies and brain waves that it needs to do its job. And when the brain is operating more effectively, you get better symptom control. So if you see over here, now she has a very clean peaks, like these clean mountain peaks right down the middle after treatment. So that's just the brain scan. The brain scan is like a North Star. It tells us how to treat and what to do to try to improve your brain. But what really matters are the results. Her results were amazing. So what we're looking at are these are rating scales that the patient rates herself on the severity of her symptoms. The first scale is an anxiety scale. The higher the number, the worse that you feel. So she started at 19. Her scores went down to a 6. PHQ-9 is a depression rating scale. She started at 23, so this is her first scan. This is the time period between her first scan and her starting a treatment. So she started at 23, which is a severe depression. She got onto a 5, which means that she does not have clinical depression anymore. The neurobehavioral symptoms inventory kind of looks at general mental health issues, including anxiety and PTSD and things like that. She started at 27. She went on to a 14. And then the sleep condition indicator tells us about the quality and the quantity of her sleep. The lower the number, the worse the sleep. So she started in the beginning of treatment as a 3. I mean, she's barely sleeping at all. She went up to a 25. So she has significant improvement across the board by knowing that secret that you can look at the brain and do something different about it. That is transformational if you've been struggling with depression and anxiety and trauma and grief and have not been able to get over it. So the old way of thinking is depression, anxiety, those are just my emotions. There's nothing I can do about it. I just need these chemicals. The new way of thinking is that the brain is actually a map, and we can find where the dysfunction is, and it is visible, and then we can do something about it. That's the new way of thinking. So that leads us to secret number three. And think about it. What if your doctor didn't fail you? He just didn't know what to tell you. He just didn't know. So, unfortunately, I've been speaking to doctors about these new advanced treatments for a long time. Some of these treatments have been out for over a decade, and they just never made it to the prime time because the pharmaceutical companies are flooding the airways with commercials and where they're telling you what it can do, but also the list of side effects is worse than your original disease. And some of these treatments are not something that's going to be advertised on TV, so even the doctors didn't learn about them. And these treatments are not experimental. Most of them are FDA approved, covered by your insurance. They're just unfamiliar. So secret three is that they are advanced treatments that are available now that can be covered by your insurance and they actually work better than antidepressants for patients who are treatment resistant. So let me tell you one last story. And this is one of my favorite stories in my practice. I'm going to tell you about Charles. See, Charles was receiving his care at the VA hospital, but he also saw private doctors. And he also bought self-help books. And he also read his Bible. And he also, tried to take care of his body. But over time, depression was beating him down. And despite working with all these doctors and with the VA, his depression got worse and worse and worse, and to the point that he became a recluse. He wouldn't leave his house. Like his hair had grown out, his fingernails were super long when I met him. He told me that his house had the grass overgrown and a rotting car in the yard, and he was that creepy neighbor that would peek through the blinds, and that's the only reason that his neighbors knew that someone lived there, and it was so different from who he was because Charles was a high-ranking officer in the military. He was known to be organized and astute, and he was a leader. And after several years, his doctors had run out of things to figure out to try to help him. Now, I know this is a extreme case, but anybody in this webinar got to the point where you were isolating and separated from your family and not getting stuff done? If that's you, type "that's me" in the chat. Just say "that's me." And for Charles, that had become his life. Like he wouldn't leave the house to get groceries unless it was 3 in the morning because he knew people wouldn't be there because he had bad PTSD as well. So fortunate for him, he had a good friend that never gave up on him, and she about found out about something called ketamine online. And since everything else has failed, she just tried to encourage him to come to my office, and eventually he did. But the great thing about it, when he got his first treatment, he got immediate results. After one treatment, he started feeling better. It gave him the courage and the confidence to pursue this treatment, and he went to the Veterans Hospital and requested our services. So once he got our services, he was able to make an amazing transformation. So now Charles, he cut his hair. It's like he looks like he went on one of those makeover shows. He cut his hair, he cut his beard, he cut his nails, he's got new clothing, he's cut his yard, he's back out, able to go out to his favorite restaurant, which happens to be Outback. Going to the Home Depot, fixing his house. He was completely transformed because he found out that there was another treatment out there other than the medication. And for him, it was actually ketamine. And that provided rapid relief for him and allowed him to reconnect with his life. So I want to teach you just briefly about four of the advanced treatments that we're able to offer that work better than antidepressants, have better side effect profile, and have filled in the gap for people who no longer get a response from antidepressants. The first is something called TMS, or transcranial magnetic stimulation. This treatment uses magnetic fields, MRI strength magnetic fields, to stimulate the brain to get it to work, uh, just work more efficiently and effectively, all without any seizure. There's no anesthesia, there's no pain, and there's no risk. It's really either works or it doesn't. And you can research anything that I say. The second is personalized TMS. It's a personalized version of TMS where we use a brain scan to look into the brain, see how the brain's dysfunctioning, and create a customized TMS prescription that's going to stimulate and speed up and fine tune the brain for your particular situation. Next is FDA approved Spravato. Now, keep in mind, TMS is also FDA approved. Spravato is a nasal spray for depression that works rapidly, with some patients getting results within 24 hours. It is one of the most novel treatments that we have, and it's the first new type of antidepressant since the 80s, because we've all just been taking SSRIs and SNRIs. Okay. And then finally, there's ketamine. So ketamine has got a lot of publicity as of late, but ketamine is a safe, effective drug that's been out since the 60s, that is evidence based and safe. Now, ketamine itself is actually not FDA approved, but there's a lot of evidence to support that very, very low doses of ketamine in a controlled environment in the right setting can rapidly reduce depression, anxiety. It's particularly effective for patients who are struggling with suicidal thinking, and it can help resolve that. Now, these four treatments are the pillars of breaking through depression and anxiety when the antidepressants don't work. So the old way of thinking is, well, if this worked, why didn't my doctor tell me about it? If this worked, why aren't more people doing it? That's the old way of thinking. The new way of thinking is understanding these are FDA approved treatments, that they're evidence based treatments that even millions of people across the country are already taking advantage of, but they just knew about it before you did. So that's the paradigm shift I'm trying to present to you guys today, is that, hey, you can't think the way that you were thinking about how to get better for treating depression and anxiety. And if you're like many of my patients, trial and error with medications led to side effects and continued illness, damaging your relationships, lowering your income, destroying your self esteem. Think about all the time and effort that you put into trying to get your mental health where you want it to be. And the more time you stay sick, the harder it is to treat. You ever heard that expression? If you don't use it, you lose it. The same thing applies to brain cells. When brain cells are sick, they start dying off, and it's harder to treat you. You do not have time to wait because the odds are against you. Think about all the years of good life you have lost because of depression and anxiety. Think about how much money you have invested paying doctors, going to outpatient visits, sometimes getting so sick you got to go inpatient without significant long-standing improvements. You pay for medications that didn't work. Let's not talk about all the money you lost just by not going to work. Man, it breaks my heart to see you suffering. And if you suffered, please type in the chat. It's time. It's time. It's time to change something. Because if you get nothing when you do nothing, it today is an opportunity to just to take an action and to have the courage to do something different, because what you're doing now, and if you keep doing the same thing expecting a different result, I think there's a definition or something. I think it's insanity, right? So I've had the privilege of working with patients with these treatments for a long time. We were the first Spravato clinic in the state of South Carolina. I've worked with several agencies in consulting, writing books, speaking nationally for Janssen. So I have a lot of experience, and I want you to know that all this experience has been distilled down into this 40 minutes that we've been talking so that you can take advantage of this. Because I don't want you to suffer anymore. Because if nothing changes, then nothing changes. So let me ask you this, and we'll close this up. What if there really was a way to significantly reduce your depression and anxiety symptoms? Just starting in like days to weeks. What if we could actually like rewire your brain and finally make you feel like yourself again? What if these breakthrough treatments that your doctor didn't even mention to you, what if those treatments were safe, FDA approved, covered by insurance, and completely accessible to you? Would you take the step? If you're ready to take that step, type yes in the chat. Type I'm ready in the chat. Because you need to try something different. Or would you just resign to just do what you've been doing, hoping for a different result? I'll tell you the truth. Like I said before, nothing changes if nothing changes. And the longer you wait, the longer your brain stays stuck in these patterns. The harder it is to get out of these cycles, the more expensive it gets to fix it. But you don't have to wait. You don't got to guess. You just have to take the first step. And when you do, here's what you get. Okay? One, we're going to map out this journey for you of how to exactly fix your depression. And step one is an interactive video assessment. And that goes for a price of $50. And I'm not going to tell you the cost of each thing, but we're just going to tell you what it is, and I'm going to make sure you can get it. And this interactive video is just a quick but powerful tool that's going to help you understand your symptoms. It's going to help us understand kind of some of your treatment history, where you are in your journey, and to make sure that you're a good candidate for these advanced treatments so that you can have the best chance for results and the best access to it to make sure that it's affordable for you. Step two, what you're going to get on this is a pre-assessment call. This is where you'll meet with one of our experts for a one-on-one consultation to go deeper into your history to make sure we align treatment options to your life. Then step three, we're going to offer you a full medical clearance. This is where you'll get to meet with a clinician who has expertise in treating depression and anxiety. And we want to make sure that you are completely safe medically and psychiatrically. So there's no guesswork. There's no skipping step. There's only responsible, customized care. The next thing I want to offer you, which is the highest value thing, I think, is this EEG brain map. It's a brain scan. This is where everything changes. And if you need this, and if you want this, we can perform that spectral EEG, which is literally a map of your brain's electrical activity to pinpoint the dysfunction that medications can't see. Because we don't guess, we just scan. And then after that, we're going to offer you a personalized prescription plan. It's going to be a customized treatment plan. It's going to be based on your brain scan and your history. So that way we can create a plan that's customized to you and not just randomly picking a medication out of a hat for you to try. And whether that's going to be TMS or personalized TMS or the nasal spray Spravato or any of our ketamine service or maybe in a combination, it's not going to be a one size fits all. It's going to be made specifically for you. Next, we're going to give you your full treatment programming. That means you're going to take advantage of the actual advanced treatments. And that may include as little as 6 treatments, but as many as 36 or more. Whatever you need to break through with this depression and anxiety and PTSD, that's what we're going to offer you because it's going to be customized to your situation. And these are these FDA cleared and this neuroscience backed treatments that have helped millions of other people. And that's where the healing happens. Now, if you put all those things together individually, it's going to be more than $30,000. But guess what? We're not going to let you pay $30,000. I think that's unfair for people who are suffering. So as a bonus, we're going to add just this insurance advocacy for you. So this is beyond just a regular thing your doctor's going to get your prescription uh, filled for you and the insurance don't want to pay for it. We're going to go in for you. Our team's going to go to bat for you. We're going to handle all the insurance conversations. We're going to push for coverage so you don't get hit with any unnecessary cost. And then we're also going to, if you're interested, include our Joy Journey Companion Guide. This is a treatment companion that's going to walk with you as you go through your treatment so you know what the steps are, what to do, what to expect, what to document, so you have the best chances of getting better. And when you put these bonuses together, here's what you get. You get this free journal, but you're also, most of my patients end up paying very little comparatively or nothing at all out of pocket, especially, this is a secret, especially if you're a veteran. If you're a veteran, you receive care at the VA, all of these services are completely free at our office. And thank you for your service. So you don't have time to wait. Now, here's the reason I'm saying this is because if you think about it, there's a lot of people on this webinar, and I do this webinar over and over and over again. So you have to take action today because there's only so many slots because my office is only so big. And there's not that many people in our community that's doing these treatments. So typically at one time, I can only accommodate 17 to at max 30 patients. And there's well more than that on this one webinar. So I don't want you to wait. You got to take that first step. So I just want to ask you, and then I'm going to go home. What is it costing you to stay where you are? What's it costing you in your time, in your relationships, in your happiness? This is your chance to change that. Okay? My spots are extremely limited. Only a small percentage of patients can take advantage of this. And if you wait too late, you're going to end up on a waiting list. We don't have time for you to stay sick. So I encourage you, there should be a button, there should be a link somewhere on this webinar. My team takes care of that part. I just am here to drop these pearls of knowledge for you. Take advantage of this offer. Start by taking your interactive video assessment. It doesn't cost you anything. I waive all those costs because I need you to know that you're appropriate. You can afford it, you can do it, and you can change your own life. All you got to do is take a step. Let us help you finally fix what's been going on inside your brain. Will you take those first steps today? So here's my final encouragement. You've been trying to fix your brain with a blindfold on. Your doctor has too. It's time to take the blindfold off. So thank you so much for listening to this webinar. I hope that something that I said blessed you. If it resonated with you, if it was similar to your story and you're ready to do something different, take action today. Start your interactive assessment. Let's just push the button. Your future self will thank you. My name is Dr. Don DeBose. Thank you so much for your time, and I look forward to seeing you in the clinic.